Thank you, everyone, for joining today. This is kind of a special edition, you can call it, of our Leaders Exchange meeting, which some of you have participated in before. We have our quarterly Leaders Exchange meetings, but because of COVID, et cetera, and we've changed the pace a little bit, and this was kind of an open community meeting, really at the behest of Jack. We were having a meeting last week, a leaders exchange meeting, and we decided to add a meeting really quickly related to COVID-19 testing, which is really a hot area, and everyone's really trying to establish their testing resources, et cetera. So we thought it would be good to just have a discussion today and share some of the lessons others are seeing, some of the requirements that we see that are going on. Also, just let you know who else is out there buying this right now, right? So you can reach out to them directly. So we can have that discussion today, but hopefully you can also just work with your peers and others across the country that are doing this. So it's all new to a lot of people right now, right? And including us. So it's best if we can collaborate. We do have a number of people from across the country joining, including from U.S. Department of Homeland Security, Veterans Affairs, San Diego, Ohio. I'm looking at the list over here. Alameda County, Fairfax County, Virginia. So a number of people, Florida, North Carolina. That's great to have all this participation. So I'd like to just first kind of pause here and welcome Jack Pellegrino, who's the director of the purchasing department at San Diego County. Hi, Jack.
Hi, Raj. Thank you. And thanks for everyone joining. As Raj said, we had a leadership exchange probably maybe a week and a half ago. And one of the topics, and I know Danny was, Danny, I don't see him on the line right now, but we talked about, we were talking about COVID, how we've responded. Each of our organizations have been pressed into this new reality of our emergency response. And we're talking about, we've kind of moved from PPE to now into a new era of testing. Testing, obviously, every one of us is aware that the national situation of we don't have enough testing. And so we've done a couple unique things here in the county of San Diego that I offered to share. And also, wanted to thank, we have used GovShop very successfully, especially when we're doing our outreach for testing services. So just wanted to share with everyone. I'm pleased to hear that a couple of my colleagues from the great state of California are on. So welcome, look forward to chatting with you. And as a result of this, Raj, I'm always open to have people email me directly. And really, I know it's overstated, but we're in this together, and especially since we as a procurement community, we are best when we don't get isolated from each other, and we look for our colleagues to for best practices and opportunities. I know my colleague to the north, Michael O. in the County of LA, has been extremely helpful for me as we try to respond for our respective communities. So thank you for hosting this. Look forward to everyone's participation that's on the line and making this a very useful hour for you.
Yes, great, thanks. And thank you, Jack, for making the time as well. I know everyone working in public procurement right now is extremely busy. So thank you for taking the time, for everyone that's joining. So why don't we go ahead and jump in? And by the way, like I mentioned, I'm in Outer Banks, North Carolina on vacation. So the lighting is not that great here. I tried to make the best of it. And if I do have some internet trouble, I apologize. I'm trying to manage, but we thought it was more important to just get this going. So let me just share my screen. And I'm going to switch over to a PowerPoint. So as you can see, we're really doing this in real time. No formalities about it. Just like if we were sitting around in a room. I do want to emphasize that please, this is an open meeting. So anybody who wants to chime in, just if you know, you can raise your hand, I think on Zoom, or just chat a question in, and Unisa will unmute the mic. So really anyone should chime in with any lessons, etc. This is meant to be collaborative and start to share lessons today. So please do that. So let me just go ahead and jump in here. So the agenda is very short, right? And I would just want to take 10 minutes to share some of the data that we've been collecting, including some of the requirements we've reviewed from across the country. So we've been pulling in a number of requirements and talking to some of the people that are doing these procurements. And so pulling some of that data in. It's a very early stage, but we thought we'd share it anyways. And then really most of the time period or time for this discussion today is 45 minutes. It should be on the case study on San Diego on what Jack and team are doing, but also really hopefully everyone else starts to chime in too in terms of what are other things going on. And we can bring up some of these slides that we've had. Just very quickly, if you don't know about Public Spend Forum, we're a market intelligence and procurement platform. So we're really the Leaders Exchange is one of the key things that we do to really bring the community together, but really we're bringing a lot of data together, which we'll share. So I won't talk about it too much here. Like I said, we've been having these Leaders Exchange meetings for 4 years now. Jack has been involved from the beginning, and a number of you have as well. So thank you, and we'll continue to kind of facilitate these discussions. Let me just go ahead and jump into the data, the most important part that everyone's here for. So just so you're aware, let me actually put this in screen share mode so if this appears better. You may know that on GovShop, we've spent a ton of time working with the Defense Department, the Defense Task Force, the National Governors Association, now a number of other organizations, including the American Hospital Association, Supply Connector, C19 Coalition, to actually consolidate a lot of data on suppliers and spending that's going on. So we can have one national directory. We're getting a lot of people coming in, being directed from the defense site, for instance, as well as from NGA, et cetera, as well. So far, you can check it out. We're not gonna spend too much time on that today, but there's over 8,000 companies, a number, over 1,000 plus verified. We can talk about what that means. Over 10,000 products. So we're trying to consolidate this so everybody isn't trying to do the exact same thing, right? Trying to chase this data down and then hopefully spend more time on just really getting the best relationships, agreements in place with the providers and the services that we need. The areas that are covered, everything from what we're going to discuss today, testing, to all the things that we've been it's kind of funny, Jack, when you said and we're past PPE, and I know still kind of in the middle of it, but everybody's a pro now. It's been really, everybody had to dive deep in 3 months. Everybody, we've got probably tens of thousands of category experts on PPE across the country. So cleaning, disinfectant products, which are really big, they're right now, especially some of the sanitizing services, sanitizing equipment, and other interesting areas like contact tracing apps, protective barriers, alternative care facilities that people are establishing. So you can check all of this out on GovShop. So we're not going to be covering a lot of that, but let me just jump to the data on COVID-19 testing. So here's what we've done so far. We have that supplier directory, which Jack will speak to, and we can show if needed. We've also been working and identifying, all the different opportunities that are going on across the country, so we can see who's buying, so we can kind of really help people meet each other and then collaborate. Really, we're trying to get out of the way and just facilitate that meeting. So we can tell you about all the opportunities that are open. We're going to highlight some of them. So, and we can send that information out to you. You can access it on our site, but we can send out the contact information, et cetera. So we'd encourage everyone to, collaborate. I think Jack, when, Danny Mays, by the way, was who Jack was referring to. Danny Mays is the procurement director for the General Services Department in the state of Maryland. So Danny and Jack were on last week on the Leaders Exchange, and we discussed the need to really collaborate, and that's why we're gonna, make that data available on opportunities and who's buying, so you can directly reach out and hopefully collaborate with them. Does that make sense, Jack? I think that's one of the things that came up, right?
Yeah, absolutely. One of the things that we found very quickly in this whole pandemic response is you tend to become very isolated. And, when we started, when I was appointed the logistics chief for our emergency response, I walked into an environment where we were very used to responding, I'll call it locally or regionally. We never really faced a national emergency like this. I mean, I wasn't here for maybe, but all of us, when we think about it, we're thinking whether it's a hurricane, whether it's a tornado, whether it's a wildfire here in California, it's all a regional emergency. And suddenly I was faced with doing outreach further than my region here. So it really brought me into a new reality. So I really applaud the efforts here of this ability to reach out across the nation is invaluable. And I think that's going to be a big part of us going forward together to be, be in a better situation for whatever the future brings us. So, but
yeah, and we're not in this alone, right? I think that's the key message you all had, right? Like everybody's struggling or not necessarily as well, struggling and trying to figure out the right solutions, right? And because it is trial by fire. So again, we'll make that data available, and it is on the site already. Also, we've started analyzing this third point, spending on who's buying in this area, from whom, right? Which suppliers, what, how. So this is very preliminary. We don't even want to, I wasn't even sure to put this image in here. So because the data analysis is quite preliminary, but we should have something next week that we can send to you, that you can see which agencies are buying, reach out to them. Again, it's part of, that collaboration, and see if there's any, lessons there that you can learn from, but also, what are the strategies they've used, suppliers that they've gone to. And so that's that last part, the supplier analysis. We are seeing kind of certain suppliers, right, pop up to the top. You can see who they are as well. This way, I think you can know kind of, which obviously certain suppliers and capabilities have already been vetted. That's important to know. Right, like who's been already vetted and gone through the ringer, and who's consistently coming out. Not to say that there aren't other providers, because we need a lot of capacity right now, right? So I don't think we can ignore a lot of the providers that may not have, won a lot of things right now, but may have very much capabilities. So that's what we're also looking at is, who are all the providers, where are the capabilities, where is their capacity? Because the capacity, especially in the testing area, is really lacking right now. So we're kind of trying to get to the bottom of that. What I wanted to spend a few minutes on is, and I thought, Jack, this would be a good discussion, is we reviewed a number of the current opportunities. I have them on a web page as well. I can bring them up if needed. They're all cataloged on GovShop as well, so you can go to them, and so you'll get the links. But we reviewed these 7 opportunities. Just again, we put this webinar together really quickly, so so please don't mind the kind of the agile nature of this analysis. And sharing it in process, but really because we're doing it as part of the community. But there's 7 different ones you can see, and they really span different types of organizations, right? You have the U.S. Department of Homeland Security that put out a pretty major RFP. You've got the U.S. Department of Navy, but then you've got a number of counties. I don't even have San Diego listed here, by the way.
I'm going to show you mine. So.
Because yeah, you're going to go over that. So we didn't. So Galveston County, Texas, for instance, then obviously universities are opening up, right? They all need testing services and capability. The Oregon Health Authority put out a pretty significant one for just their assisted living facilities, 680 of them or so across the state. The state of Kansas put out something to really provide to the entire state right? So there's a whole mix of these, and again, you can imagine everybody's out there. So what we did is, again, I'm about to bring up the next slide. Please don't mind the cursory nature. I keep qualifying all of this, and maybe I shouldn't. So, but here's just some basic things we saw. A very quick review of the requirements as we read them, right? And we've talked to some of these people and been working with them. But this would be a good stopping point, actually, maybe start the discussion, and then Jack, hand it over, your case study, or we can come back to this slide. But, what we wanted to highlight are, what are requirement statements looking like, right? What is going into the statement of work, right? And I'll tell you, my view, as I looked and reviewed a lot of these myself personally, I was, one, surprised by how skim they are. How bare bones they are. I think it's because people don't know exactly what to put in there, and they're really kind of meant, which is good, right? I actually think that's a really good thing. That's not meant to be a negative statement. That's meant to just kind of highlight the fact that they're very, very high level, sometimes 5, 6 bullet points, and that's it, because people are trying to figure out, what should they include, right? So that's not a bad thing. That's typically happens when you have something new, right? But here's how I've broken it out. So let's maybe we could talk about it for a few minutes and then come back to it, Jack, whatever you prefer, or we can go to the case study. But a couple of things very at the highest level on procurement acquisition strategy. We saw is, across these 7 at least, there were, intended for full service providers that could provide the soup to nuts on requirements that you see below, right? To also open to really bringing in niche providers where, for instance, you could get the testing kit separately, right? Get the lab processing separately, the administration of the tests separately, right? So you could kind of assemble all of those pieces separately, right? So there's kind of the whole gamut of those. And there's obviously, and we're gonna lay out a picture that shows that what are the full set of things that are required, right? To go from, actually setting up the test and taking the test all the way to the kind of hopefully getting to the end goal and the outcome of lowering, your transmission rate. So that's the first bullet point. The second was, they're open indefinitely in many cases. There's no end date, or the end date is end of 2020. Again, that's acknowledgement that, there's scarce supply out there, and we want to keep it open and just keep discovering new sources. So are you surprised by any of that, Jack, the first couple of things, or?
No, a matter of fact, and Raj, you and I did not collaborate on these charts, but you just described everything that has evolved here in the County of San Diego over the last, I would say, 30 to 60 days. As I said, we started with PPE. We have our secure supplies now of N95 respirators and face shields and gowns and other PPE. And we moved to testing. And very quickly, we signed a short-term contract with a local laboratory named Helix here in up in our biotech area, it's called UTC, University Town Center. And they also now have been awarded a $30 million award by the National Institute of Health they were a DNA, their forte is DNA. And they quickly developed a COVID-19 test and had an emergency use authorization from the FDA. And we contracted with them very quickly to do 2,000 tests a day to augment what we were already doing in-house. We have our own public health laboratory where we have multiple machines, and we were doing 2,000 tests a day by ourselves. Plus, then we were using the typical commercial labs that you all are aware of and know of, Quest and LabCorp, is the name too, and they're I'll call it the mega labs. What we quickly found is, and you did a great job of describing there are different methods and types of services here. For our public health lab, we were using our own collection kits. We were using our own public health nurses to collect the samples. We actually set up our own testing locations, our own lanes. Conversely, depending on what organization you are, you need something that's more turnkey, what I call turnkey. That was something that Helix offered to us. They were doing some of their testing in their own parking lot outside their location over in UTC. And they also offered to us that because of their testing protocols, they actually provide us the kits, and the kits are pre-identified and barcoded, which tremendously increased our efficiency of reporting results. So, as you probably have all heard, one of the big issues in the national testing scenario is the timeliness of those results. It does anyone any good to have results that take a week or longer to get back. You're outside of the disease period there. So it's really, so in our contract and in what we've been doing here in San Diego, our results are the next day. The contract that we established with Helix is the next business day. And it goes further than just, as I said, just they're giving us the pre-identified kits with barcodes. We are collecting, the samples are even self-collection samples. The media that they're providing us, and it doesn't require a lot of extra handling. For example, it doesn't need to be refrigerated in the handling process, doesn't need to be administered by a nurse. There's a nurse or a health professional that observes the self-administration of the test. And then Helix will process the test and also do appropriate reporting both to us, the state, and then also to the individual. So we're really excited about that. And that's why when you saw in your own analysis that the contracts are wide open, I think that's probably because of the very broad set of needs that each of us find ourselves in individually. So sorry for the long dissertation there, but I think you hit all the key issues on your chart.
No, I think that's great. I think that's part of that case study. Maybe I can just touch on these points, and then, you know, Jack, if you have kind of broader set of things you wanted to highlight. Yeah, I think that's that you're absolutely right. That's what you know, we've read and seen, right, in a number of these requirements, the way you described it. I think the testing kits materials, right? One thing that's not noted here, there's obviously different types of tests, and then the FDA authorization or emergency use authorization is a key requirement, right? Without that, no test is valid, right? So that's really critical. One thing that we've also been collecting here, just so you're aware, is I am trying to bring up this other screen, is the efficacy of the different tests. So what data is being recorded in terms of the reliability. So we've been actually gathering materials and data that shows what's the reliability that people are seeing of these different tests. So we can share that as well. But I think the second thing, Jack, you were highlighting the administration and management of the testing process, right? There's a whole myriad of methods out here, right? From kind of self-administration, right, to actually the full outsourcing of that, where, you know, basically the organization that you bring on, there's an on-site, you know, testing where they take it soup to nuts, right? They bring the materials, they bring the testing kits, they administer the tests, and then they bring back the results. But we also saw a couple of other things where, you know, establishing sites for testing. So this was another unique thing that stood out, just as one example, just to highlight. So in some cases we saw there, you know, there may be a need, right, to establish other mobile sites, et cetera. So the ability to do that was one of the other unique requirements we saw. This was unique. I thought, you know, initial comprehensive testing so where there's this kind of, organization comes in and does basically test every single person in the organization, right? And then from there on, it's ongoing monitoring and evaluation and testing. So there's this first kind of ramp up of test everyone, and then there's kind of pool testing, et cetera, that happens after that.
And I think, Raj, if I may interrupt right there, that is going to be a key strategy going forward. Let me start by, whether it be in your medical facilities, for example, we have something called skilled nursing facilities, which are, the aging adult facilities and nursing homes that we are at high risk. There's a protocol now that we test those residents multiple times a month to make sure that we don't let any infection get out in front of us. Also, you're going to see some of those strategies implemented as we start to open other large groups, for example, the schools. I have, Helix has been talking to a couple of the, albeit smaller universities here that have made the decision to go ahead and move forward and have some on-site instruction. And doing that, we want to make sure that the timeliness, it's all about the timeliness. Your last bullet there about processing the test, that's really key. But you're probably going to find our situation where we're going to be testing folks a couple times a month within that window. And so the reliability of those tests, I'm really glad to hear that you're starting to track that reliability, because we cannot have false positives. Yep. You might as well, that's as useless as a delayed result. When we went through and set up with Helix, we gave them 60 samples of both positive and negatives, and we had them, we gave them, and they had to validate back to us those, and all 60 matched. Actually, 59 matched, because there were two that were, there was one that there wasn't enough DNA in the sample, or there wasn't enough median in the sample to get a result. So it really wasn't positive or negative. They just couldn't draw a result from it. But, 100% reliability is kind of the benchmark.
Yeah.
Raj, I saw a question pop up, and I don't know when you want me to address that specifically.
Yeah, no, it's Deborah. I want to first of all say to Deborah, I apologize. Deborah Zides is from a leader at MITRE. Many of you may know MITRE does some great work, and has also set up the COVID-19 Healthcare Coalition, which should be on that page I just showed earlier in terms of our collaborations. So, there's a great set of resources on the MITRE site, the COVID-19 Healthcare Coalition site, in terms of all types of resources, and Deborah can speak to that. But definitely we'll send that out as a resource and make sure that you're accessing all the great work that's been done there. But Deborah, I know you had a question. Jack, you want to take this? Because I think it's going to be best suited for you. I read the question and I was like, Jack, let's see what Jack is doing about this.
Yeah. So Deborah's question was, can I speak to the challenges of getting a RFI or a contract award through the review process? And if I were king for a day, which that would be cool, but I'm not. I'm just the logistics chief. What authorities would I change? Well, I am truly in a unique and very positive situation here with the county of San Diego. I sit at the executive level in the Emergency Operations Center and in the Incident Command Center. So with full Board of Supervisors authority and kind of engagement. We have allowed, I've been able to implement, I'll call it streamline, our existing award practices. We still do things full and open competitive, but we don't use our normal BINET system the way we did. I use SurveyMonkey in some cases, and we moved very quickly to get awards, both sources identified, them vetted, and then awards made within record time. The Helix contract, for example, I think I went from, initiation of contact to contract award within 2 weeks. And that was all properly approved by all my internal stakeholders. So that means the customer, public health lab, the director of health and human services, county council, obviously, and then ultimately the board that reviews, albeit it may be the week later, they'll do a review and ratification of the things that I've done the weeks prior in response to the emergency. So I guess what changed for us is I had a very sound practices and the trust of the board and and me having a seat at the table, which has allowed us to operate so effectively and quickly.
And that's great. And I'm guessing also, Jack, there's, and we've heard this from everyone, given the unique circumstance, this is obviously an emergency, like any other, or any we haven't seen. So there's a lot of flexibility from an emergency standpoint, right? The flexibility and a lot of the awards that we've seen that can be made.
So one thing about the award that I made to Helix, I made it as a short-term award, recognizing that we did do a search of the industry, who had it. We did our due diligence. I made a 4-month award with, I think, 6 1-month options. So, and concurrently, and they knew this right from the beginning, that I was going to solicit a more typical procurement for testing services. And that's, if now's a good time, Raj, that's what I could take you through.
Yeah, please, Jack, please go ahead. And as Jack's bringing that up, please, if anybody else has questions or would like to just us to unmute them, so you can join in the conversation, please don't be shy. Just ask Shanisa, she will unmute you.
Okay. So hopefully, Raj, can everyone see? Hopefully you're seeing my screen. It's the County of San Diego webpage.
Yes.
Okay. So this is our homepage. And what I've always told my staff is I can't be more than 2 clicks away from useful information. So under business, and then right under procurement, I see open solicitations. And so this is refreshed hourly here. So it views all my open, we call it our BINET. So this is my public facing portal for all vendors to see. As you can see, I have requests for informations in here, RFPs, RFQs. I do have bids in here, but the one I want to point out to you, which is the more traditional one here, it should be in the middle, for my COVID-19, let me see if I can find it. Let's see. Long list, huh? Here it is. I went too fast. So my RFP for as needed COVID testing, reporting, and notification services. So as you can see, I posted it just a few weeks ago. And the proposals will close. You know, we wanted to make sure that we gave adequate time for everyone to respond, because when you get into this, when you get in and review the solicitation, by the way, you can, anybody, this is open to anyone, you could register on the system and download a copy of this, and I would encourage people to do that. It doesn't say that you have to submit a bid, but or a proposal. But what we wanted to make sure is we had adequate time for a very broad response. And when you look at our solicitation, we allowed ourselves options for different types of services. So for the situation where you're an organization that can just provide the testing. So you take our kits, you test it. And maybe you can't report results. Maybe you just report the results back to me, in which case the county will do the reporting and notification services to the clients. To a more full service, we call them lots. There's different lots in this solicitation, where we'll have a full service lot, where an organization can come in and they'll say, "Hey, county, we'll set up a testing lane at a location of your choosing, and we'll do turnkey." You know, in some cases, we're expecting that some people will even do their own scheduling rather than letting the public health office do the scheduling. So that's our current solicitation that's out there. And I'm looking forward to one of the things I can share, Raj. The second thing is what I use is the GovShop tool, and I'll drag that over here. Is when I ask my procurement staff to go ahead and you can see my recent search here is what we did. And you know, what we did was we looked at this and then we did some, we sorted it by, you know, we kind of, for people that were validated, we wanted to make sure we were able to get more than just the people that we were individually aware of. So it really did help us. The work that you've done, it really did help us. And I asked my team to go ahead and do an outreach to those organizations that were on this list that we think, so to make sure that I have a robust, so David was the person that who did the outreach to them. And it may be as simple as an email to them saying, "Hey, we'll just make you aware that this is out there." So I'll report back to you in about a week, maybe a little bit longer, after I see how many results we get. But this is something that we've done. Last thing I want to show you all, when we go back a step, because I saw a comment came up about the use of our SurveyMonkey.
Yeah, Ben from our team, by the way. I think Jackie, I think you've met Ben.
Right.
He's loving it. He's you know, innovation at scale over here.
Yeah, that's what we did. So this was my assistant director thought of this. But if you go under our home page here, we knew that using our normal BINET, you know, solicitation process wasn't going to be sufficient. So here's just recently something we did. We have something here in California called Great Plates, and that basically it's a California program that is to serve senior adults that may not be getting the proper nutrition and meals. We're delivering to them home delivered meals. So rather than going through I'll call it my more bureaucratic BINET system, I simply put up Great Plates delivered. You can see the RFQ is up here, and we've done one for 3 meals a day, 7 days a week, or there's another one for 1 meal a day. And so what you can do is basically go through several questions, right? Fill out your data. We will then look at that information. We're basically soliciting, and it's a streamlined way of getting that information rather than a formal proposal, upload your information into a bureaucratic government system. This is what we've come up with. And I think it meets the two tests that keep me up at night, that are really, really important. Not keep me up, but is fair and full access of opportunities to the full vendor community and supplier community. And also, can I demonstrate, because I will have to demonstrate both to federal requirements as well as my taxpayers, that we had fair and reasonable pricing and that we've done it competitively. So I think by doing something like this, we will be able to meet both of those tests. So I'll shut up now.
This is great. Now this is very streamlined, and everyone is obviously familiar with SurveyMonkey, et cetera. So I think that's a great example there. Jack, a question that, and if anyone else has perspective on this that wants to chime in, question that came in is around, is there enough manufacturing capacity on testing kits? I think we know the answer rhetorically, but I'm just curious on, is it, so in other words, are we relying, are we open to non-US sources of kits, right? Or if they're FDA obviously if they meet some emergency use authorization, et cetera. What is your thinking on that?
So my thoughts are, I think it's causing all of us to rethink our supply chain. I know, Raj, you and I in the prior session were talking about what does Buy American, have we allowed our supply chain to be stretched, become so globalized that we put ourselves and our constituents at risk. So rather than get into that, I will say, we have taken the approach. We always first look for FDA approval, CDC approval, and I think we're going to face something in the future that all of us look at our organic manufacturing capability, supply logistics capability. I think I am encouraged from what I see that there are, the CDC and the FDA are being very proactive in their emergency use authorizations and authorities that they're giving to, for example, like an organization like Helix. And I really like the fact that the administration and other folks are allowing multiple things to happen at one time. As a matter of fact, somebody described to me what NIH did was they actually called it a Shark Tank, where they started with I forget how many hundreds of applicants and whittled it down and finally got to the set of awardees that they did for their grant funding, one of which was Helix. So I think personally, I'd like to see more U.S. manufacturing, more U.S. Because that's something I think is important to us as a nation. Would I, international sources? I guess I'll never say never, but I think we need to see what we can generate for ourselves first, and then clearly try to, think locally. So my view is I'm thinking locally, and then I'm going regionally, then I'm going, call it nationally, and then international would be on that. So
Jack,
that's.
I thought I could share. Let's see. Honestly, I don't know what this is going to show us, but I'm just curious here. So I just went to the COVID-19 testing page on GovShop. And by the way, I just in case you're looking to get to it, all you do is you can just type in COVID-19 testing like Jack had, and actually just search by commodity codes, and then you'll see just the different codes pop up. So I'm just going there. What we did is, there's a number of other things like molecular tests, the test swabs, reagents. So there's a number of things in here, antibody tests, which are not the COVID-19, not the detection, right? That's the post-detection, whether you've had it. So, but if we're looking at these approved testing kits here, I'm just curious if we go to this for a second, and if we looked at how many of the FDA authorized are, let me just go to the sort and filter here and see how many of these are actually, non-US. So there are 152 total companies. If I just did United States, that'll tell me how many. So 123, okay. So that tells us at least there's 29 that have been approved by FDA under emergency use or FDA authorization that are non-US, okay? Because there were 152 total, right? So just keep that in mind as you're looking. I think the fact it just seems right now, I guess under emergency, there is a need for, expanded capacity. So I'm guessing people are also looking internationally to meet the need. Now, your point, Jack, about domestic sources and building our supply chain, those definitely become issues we got to kind of plan for better, and hopefully start a better movement around kind of more domestic manufacturing, et cetera. But would you agree that in the current sphere, obviously first look for your domestic sources, but if you don't have them, you have to look outside if they meet the criteria, certification, et cetera?
Absolutely. I mean, and like I said, I kind of, to simplify it, I think we look locally first. We look at people within our region first, and then we went California, then we went, then we went nationally. On our Department of Public Health and our experts there, I will call it our, they're because of their background and because of their public health, they're less research oriented, so they're less likely to push. They want proven, whether it be media, whether it be, we've been very conservative about which technologies we've even though they may have been approved for emergency use, we've been very diligent and I'll call it conservative about which ones we went for. So, but your tool, I'm glad you did that tool, because when we first issued our RFP a little bit more than 3 weeks ago, that's exactly what David did. And at the time when he did that search and he showed me a result of it, I think there were 100 and a little bit, about 120. So it looks like that number's changed, increased a little bit, but still, it was a very valuable tool for us. So it assured me that I'm getting the full view of what's in the industry.
Yeah, no, we've been, just so everyone knows, on a daily basis, across different certifications that are being issued by FDA, EPA, et cetera, we're monitoring those and updating those regularly. So, there's been, like, for masks, for instance, there's been a lot of companies that have been decertified. It's a little confusing, but we've gone in and changed that, so everyone has the latest information. I do want to just mention a couple of more things on these requirements that we saw, in case they're valuable for others. And we do have a document where we've copied and pasted the requirements in one document, so we can share it with you. So you can just look at them and see which ones are most valid for you in your organization, right? And the scope of things that you're looking at. But counseling patients was another one. So that was unique. I saw that which was explicitly called out, counseling patients that have a positive result. And then there was another requirement that we saw that was around training for others to administer tests, right? In the county, in the city, the state. Billing and insurance. So there was one requirement that was around, just processing anything related to insurance, et cetera. And then, of course, reporting is, common across everything, right? That's really, really important. Both reporting kind of, the regular basis, the test results, but also kind of broadly, what's the efficacy of the tests, any kind of false positives, those types of things. Right. So again, we'll put this as it says in the red over here. We'll try to kind of consolidate this and this analysis and show it to you next week. I do want to show you here. I'm sorry, this is the wrong tab. So these are all the different. We'll send you links to this. These are all set up on GovShop right now. These are all the different ones I just highlighted, opportunities or open RFPs or requirements that are going on. So you can see, which county, city, state, federal agencies doing it. And you even have a contact person you can contact to see if you want to see, and collaborate with them. So we'll send this information out. So you have that, but this is all cataloged in here and easily, you can go to any of this and even create a list off of this. Let me just go back, Jack. Anything else? I think, in the PowerPoint, I don't have anything else right now, but to highlight that we're going to be completing some of this analysis and bringing back. Would be great to hear from everyone, what else you'd like to see so we can share it with the community. I haven't seen anything yet, but you can email us at any time. Jack, Anything else you'd like to highlight? You know, we're at about 8 minutes of, um, you know, lessons for everyone.
Yeah, I think the key thing is, is it's in a time like this, the thing that helped me the most is to reach out to colleagues, whether it be you, whether it be the other counties, other cities, other jurisdictions, and kind of brainstorm. And so we can benchmark. And that's one of the things that, we got so busy in trying to be immediately responsive that I really appreciate the work that you guys are doing, because you serve to help me benchmark and validate some of the things that we were thinking of. And frankly, we're happy to be able to share with other ideas, because what we've done here in San Diego may not fit, whether it be in Alameda or whether it be in LA or whether it be in Kansas, or even, the Outer Banks where you're
Yep.
at. So, so that's the main thing is, so thanks for the opportunity to share. And, I don't know what the future will look like for it. I think the future will be good. I think it will be, we will get through this. We will hopefully cause us to rethink how we do procurement. I know myself, I'm going to be rethinking that and learning from great things that you guys are doing out there as well. So thank you.
Well, thank you. Thanks, Jack, for joining. And really, we're all learning from each other. So I think that's the most important thing. Just collaborate and keep an open mind. And I think Danny, mentioned this last week, right? This is not about guarding kind of, I think it was like he mentioned last week, and I think you did in some way as well. It became a competition. Hey, who can get the mass? Who can get, and then guess what? We're creating a disadvantage for ourselves as buyers, right? And so it's important to collaborate and keep those lines of communication open. What we will be issuing, just so everyone knows, one thing I didn't mention is a price benchmarking. So we've been doing a whole exercise on basically gathering a lot of detailed price benchmarking data. Because right now there's a lack of price transparency in the market. And so we've built out about 900 rows of pricing data, and then by product area. So we want to share just so everyone at least has a range. It's not perfect. It's lacking some information that, I would typically want in a price benchmarking analysis. But I think it's a useful tool that we can share with everyone soon. So I don't see anything else, Jack, on the chat here. So I think we might be good to go here. Well, thank you, everyone. Thanks, Jack.
Thanks, everyone. Have a great week, and we'll see you next time.
All right. Thanks, everyone. Talk to you soon.
Bye-bye.